Good morning, everyone. My name is Ridha Sachdeva, and I am a counseling psychologist here at Bhatia Neuropsychiatric Hospital. I hope I am audible to everyone. Okay. So what I'm going to do is that this meeting is a little special, okay? And we are going to give you a 1-minute solution to your 5 minutes of impulsivity, all right? First of all, I would like to continue what J.P.S sir was saying right now, that how important it is for family members to come in the hospital and to seek treatment and help when their patient is in addiction or in some other form of mental health disorder. We as a family do not realize that what kind of power we hold over our loved one. What we feel is, as a wife, as a daughter, I am not strong enough to take care of my father or husband, and I cannot help them manage their disease, or why will they listen to me? What do I have to say? But we in this meeting are trying to tell you what you can do, nobody else can. What the love of family can do, nothing can do that in the world, not even the treatment. Because the treatment that we are trying to offer to your diseased patient is actually consisting of a very major part of your family. Why do we emphasize so much on family meetings? Why do we call family members here regularly? Why are we saying that come and sit in the meeting? Because we understand that with family, we can cure the patient of the disease. We can help him manage his disease. At the end of the day, when your patient is going back home and you are not getting yourself treated for your own thoughts and fixed behavior patterns, somewhere down the line, you are causing a rift between the patient and his recovery. You are creating problem for him to recover because I am assuming that you all must have heard about shadow illness. Because of your patient's disease, from so long, you have created yourself, you have created a bubble around yourself, and that has become a shadow illness for you. You're getting the symptoms of the disease, which are not anything that can medicine or medical line can explain, but they are making you the person that you're not. So why are we talking about impulsivity today? Because being a family member of an addict or anyone with mental health disorders, over the years we have learned two fixed behavior patterns. The first is enabling, the second is provoking. If the patient is not listening to you, you will try to enable him. What you will do is, you'll try to sweet talk to him. Okay, do this, we'll do that for you. Okay, I will listen to you. Okay, you are having one peg of alcohol, that is fine, don't do it more. We'll go out in the morning. You're trying to smooth talk him. You're trying to tell him that you are building a cushion, a bed for the loved one, or else you're provoking him on the other side. What you're trying to do is, if you are going to get drunk again, I'm going to leave you. Your eyes are red, you must have had something outside. So there's no balance between the behavior that we are actually trying to change. What we are doing is that we are fixed in our behavior patterns and we are creating problem for the patient. And sadly, families, they themselves become diseased over the years. What we are trying to portray here is that the patient's need of treatment is really important, but you have the greater need of the treatment. You cannot just assume that your patient is going to get fine when you are not trying to change yourself, when you are not trying to change your own fixed behavior patterns. So what is this 1-minute solution to your impulsivity? For example, your patient, he has had 3 months of program in the Hermitage. He comes back home and he's behaving weirdly. For example, he's not talking to you. He's keeping quiet, or you are getting suspicious of his behavior pattern. And you are having this urge of arguing with him, of fighting with him. What that urge is trying to tell you, that he has done something bad. You need to provoke him, because when you'll provoke him, he'll say something honest. You have to manage your thoughts that very moment, because if you would not, you are going to push the patient away and he is going to get close to the drugs or alcohol. What you're going to do here is, number one, the step one for this situation is that you have to tell yourself that these are not your thoughts. These thoughts you have acquired over the years. This, what we are doing is, we are trying to detach from the situation. When I am saying that I have the control of the situation or these are my thoughts, I'm taking the responsibility of my own thoughts or my actions. I am trying to tell you here is, detach yourself from the situation. What you have to do is, you have to say, these are not my thoughts. These are my sick brain thoughts, which was suffering from shadow illness from past so many years. This is the stage one. Detaching yourself from the situation is very important. Number two, why these thoughts are coming inside me? Because my patient was diseased, and because of his behavior, because of his disease, I have learned, I have acquired these thoughts over the years. Now you are giving the responsibility of your own thoughts to the situation, to the brain, that no, I did not learn this, I did not do this, my brain made me do it, my chimbrain made me do it. Over the years, I have learned these thoughts that are making me impulsive. Number three, the very most important. You have to tell these thoughts that I am going to do something important and I will get back to you. And I will get back to you. I will repeat again. You have to tell these thoughts that I am going to do something important and I will get back to you. What you are trying to do is, you're creating a distance from the situation. You are trying to manage your mood and your behavior and your brain at the same time. Now, what are these important things going to be? You can call us, you can call Dr. Bhatia, you can call anyone on the team, or you can start doing some important work in your house. For example, any household chores. You can clean, you can cook, any mismanagement that is there in your house, you can do that work. And you will realize that after 5 minutes, that thought has gone. And then you have to pat yourself at the back that I did this. Now, this solution is not going to become really strong overnight. You need to practice it. Every day, every minute, you have to practice it. Do you people know that a human mind gets around 20,000 thoughts in one day? In 24 hours, your brain is making 20,000 thoughts. And we here think that we can control our brain, we can control our mind, we can control the situation. Are you trying to tell us that you are that strong that you can manage 20,000 thoughts? Nobody can, not even us. Even we are not that strong. No one in the world is that strong. But what you can do is, you can practice detachment. You can practice this solution. Do not let your emotions overpower you in the situations which are really hard. I may understand that sometimes your patient, your loved one would behave in a manner that you do not seem fit, or you do not seem that it is appropriate according to the situation, and at that point of time you're feeling really aggressive, really angry at him for whatever bad he has done to you or your family. But you at that point need to realize that your patient was not trying to hurt you. I'm using the word patient here. He's a patient, he doesn't know what is happening to himself. You need to understand this. Your loved one would never try to hurt you, they would never try to harm you. It is their disease that is making them behave in a manner which is not acceptable. 4 steps, 1 minute, you can manage your impulses. And if you learn this, you're going to help yourself, you're going to help the patient, and same goes for the patients as well. Whenever they are having cravings, whenever they are having thoughts about any sort of substance or alcohol, you can do these 4 steps, and I assure you that your impulses, your cravings, it will be a story of bygone. Any questions? Any questions? All right. Thank you so much.